So sure, burnout. I mean, one of the subset topics in terms of professionals or anyone on the front line. I mean, obviously the demands on your time have been much heightened by what's going on, and burnout is something that people deal with in their careers on a regular basis. But over the last year or so, that we've been all contending with the pandemic, working remotely from home, or going into an office setting where you're potentially exposed, or having to deal with childcare issues, um, any sort of issues. If you have elderly parents and they're in a retirement home or long-term care facility, and the worries and the anxiety and the mental health strain of not being able to interact with other people or engage in the physical exercise activities or entertainment or the social activities that you normally engage in as ways to enjoy your life when you're not working, are all having a huge impact on us. And whether that affects you and your ability to carry on in your profession or your career, those are legitimate reasons to be making a claim for disability benefits if you find that you're having real difficulty and struggling going on. That's what your insurance policy is there for, to address time periods when you're too sick to work or are not able to function in a way that you're required to fulfill your professional obligations and duties. So if that description applies to you, then you should be looking into pursuing your claim. That's what the insurance is there for. So of a particular area, subset of cases that we work on are people that are doctors, dentists, other types of professionals. But the focus of today is primarily in the area of healthcare providers. Anyone who's been on the front lines, who whether it's in a hospital setting or even in a physiotherapy clinic or just a regular dental office, or anything where you're seeing people on a regular basis, there's no doubt a great deal of concern and worry about being able to function under those circumstances. And I've spoken to a number of professionals who are glad to be able to be back out there serving their patients and clients once again. But there are professionals that have some underlying health issues of their own and feel being on the front line and being potentially exposed to people that might transmit the virus, that this may be too risky for them, and this may be a time when they might be thinking, I'm at a point where I was struggling in my practice. I love what I do, but I want to keep going on with it as long as I can, but now the risk is too great. And this is a time for you to review your policy, whatever it may be, whether it's one that you purchased yourself from an agent or a broker, or one that you have as a member of an association, to see what kind of coverage you have. And if you've made a claim and are getting the runaround because the insurance company seems to think that there's nothing other than COVID that should be interfering with your ability to practice, or you're wondering how the provisions under your policy apply or work in these circumstances, it's an area that is somewhat ambiguous and uncertain. And we would invite you to contact us to discuss that, whether you're considering putting in a claim or are in the midst of a claim where you're getting answers that are not completely satisfactory, or a decision keeps being put off pending further information and about what's going on with you. You should be consulting with experts in the area like our firm to find out what your rights are and entitlements. These types of professional or individual policies have provisions in them that are a little more specific and unique to your practice in most cases, and don't accept the first answer you get from an insurance company about your entitlement without checking it thoroughly through one of our people here to see if there's some way we can assist you if that's something you need to pursue.